All right, we're here with a patient. I didn't want to record her the first 2 visits because you were in severe pain, and I'm not going to have you just wait for us to start recording and stuff, okay? But gratefully, she's agreed to allow us to observe, okay? Just let me know what you're experiencing. This is going to be prior to 3rd visit treatment, okay? So what's still bothering you and what's improved since then?
What's improved is I can sit and get up on my own.
Okay.
I'm still tilted, so that's my main concern.
Okay.
But there is improvement, major improvement since the last visit.
Continue the antalgic lean. Okay, so I want you guys to observe her tilted is called an antalgic lean. It's a tell or a positive sign that there is a disc herniation involved, which causes the body to involuntarily shift to a side, which causes a relief of the pressure on the disc. Okay, so let's get up slowly, no rush. I just want people to observe and see if they know anyone in similar scenarios, okay? This is significantly improved. Just take a few steps that way, okay? And she is not doing this on purpose. It's her body. Just turn around, Suzjan, you're good. And this allows me to just see what's improving, what's not, okay? And if you can imagine, every small task she performs on a daily basis has become painful and impossible, okay? So our goal is to get her better so she could go to work next week. Look at you wearing the support today. Oh, but you feel it's not the most comfortable. I know. Okay. Do you need my help? Okay.
I mean, yes, but...
Okay. Yeah, I get. Oof. Do you need it lower or we're good?
No, we're good.
Okay. Headpiece is good. I can make it wider. Okay, so she is in a state of pain where we're not gonna really twist her too much or anything like that. Worst case, we're gonna use drop tables to finish what we couldn't, but we're gonna palpate the SI joints, which is your sacroiliac. Okay. So this is inflection. We need to put in extension. So this block ends up going on your iliac crest, 45 degrees, to introduce flexion and extension. And this goes to the hip joint. Relax. Okay. Don't let this fool you. But right now, she appears to be balanced. Is that better for you? It's okay. So while she gets stems, this is kind of gonna allow her weight and gravity to push the pelvis back to symmetry. So if you put this on the iliac crest, this actually pushes the pelvis into a flexion. This side we put on the hip, forcing it to go into extension. So we're kind of doing this motion or movement to the pelvic region. Before stems, we're gonna do the ultrasound. We're gonna do 50%, so it kind of is more of a ice, okay, setting than a heat. If you are in a state like this, you could do heat if it helps you relax, but always end with ice. So if you're inflamed, things are moving fast. And if you heat something, it's gonna move a lot faster. You wanna slow something down, you cool it. So that's why ice is recommended. So we will heat her at times through this treatment, but at the end, we are finishing off with ice, okay?
I know you told your friend you're not okay. And tell me what's wrong and why you never said you felt that way. And guess you're trying to stay strong and fake a smile until I look away. But I've known you too long, it hurts to watch your blue eyes fade to gray as you fade away, as you fade away.
yeah, I'm about to fade away. Cause every time I wake up I feel like it's Monday. Something's going wrong with all the chemicals up in my brain. All of a sudden I don't look at anything the same way. Gotta build up of my thoughts sitting in an ashtray. I'm sorry that I'm so inconvenient, okay. Just let me be me and I'll stay out of your way. I can see the way you look at me, I'm such a disgrace. I never really asked.
Daughter surprised me at work. Come say hi to YouTube, Bales. Come on, you're gonna see yourself on YouTube, like Diana and Roma. Henna, hi YouTube, Asa. Like Nastya, Bales. Okay, Papa Nashkati. Ha, Pupush. Okay, bye.
With this back, thought was alright.
I'm sorry?
Thought was with this
Oh,
back.
yeah. Well, we gotta get you better. I was talking about that with your mom. I'll adjust when you guys decide. Okay, I'm gonna expose the back. Okay? Yeah. So for her, we actually have recent MRIs obtained, which usually isn't necessary, at least for me, because the treatments are the same. But I do tell patients it does help for me to be more specific. So for her, we know it's at L4, and I'm able to actually go directly on the exact segments that are injured and spend more time, focus, and pumps on that level. And it's only on L4, but if it's a recent tear, the pain is excruciating. Everyday movements, getting dressed, just coughing and sneezing, which increases intra-abdominal pressure, can pop that disc even bigger. So imagine being in such a state of dis-ease, hence the word disease. It's dis-ease, that every cough or sneeze causes excruciating pain. So I've experienced it. It's like having a knife cut top of your body and the bottom, right? Like literally just a knife. Okay, right in there. Okay. And this is not something we want to rush. How we doing? You're okay? Remind me, did it shift a little last visit? Did we have one level that kind of shifted?
I think so.
Okay, just when you see as many patients as I do, they kind of start.
Yeah, I think it did.
Good. I do remember something. I just want to make sure it was you. Okay. All right.
There is definitely a difference.
Yeah, I mean, you're gonna feel it today too by how much it actually opens up when I'm pumping, and it's not gonna be as painful, okay? Because the first visit's usually the hardest. Everything's compressed, tightened, not moving. And here comes Dr. Rafi with his decompression table, causing motion or mobility, opening things up that don't want to be opened, or in a sense, have immobilized to protect further injury. Okay, but that's not necessarily what we want long term, because then you get scar tissue, degeneration, loss of motor, nerve function, strength, all of it. You ready? Breathe in, all the way out, and right there. So L4 used to be popped higher than the other segments. It still is, but not as prominent as last week. And I do have my arm at a weird angle, so I could ensure I'm going as inferior to superior in regards to my line of drive as possible. If you push P to A, posterior to anterior, too much on a sensitive disc, she's not going to get off the table for a few hours. Or she's not going to be able to get out of bed for 2 weeks. It's that sensitive. So I do have to put myself, unfortunately, in certain angles and positions, but do so with the best intention of my patients in mind. And I know you're here dying while I'm explaining, but you gotta go through it, okay? Can I go?
Yeah.
Breathe in, out. And I don't just do the lumbar. For me, I like to end up doing a general stretch in the thoracic region as well, because even though I'm stabilizing here, indirectly, this is opening up and the spine has different angles. So by pumping here, I'm indirectly pumping the low back at a slightly different angle or position compared to if I was to do it down here, and it may just give you that much more of an advantage. Okay, you need a break?
No.
You sure? Okay. And I'm beginning to switch every set, just so I use both sides evenly. Okay. Breathe in. There it is. Good. These the bigger stretches, I don't pump as much. I'll just pump slow and hold. Give a nice distraction. Talk to me, you okay?
Yeah.
Pain eased off?
Yeah.
Okay, good. You could tell by the her breathing slowed down. She's not as guarded, so that does tell me that disc pain is not as much as compared to the beginning. So, okay, this is where we kind of now slow down, go based off her energy, her breathing. Okay, good. It's so quiet in here. You hear all the chaos outside. One kid, right? All right, you ready? We're gonna switch up, okay? I'm gonna slowly bring it up. All right, and I'm gonna do just a few more pumps.
It's not the lower back that hurts. I think it's just the pressure point.
Where my hand is?
Yeah.
Yeah, so if you do have a disc injury, when I do treat, patients say, and this is how much pressure I put on every level, nothing more, but they feel like I'm really pushing on it. No, since the segment is injured, patients describe it as it feels bruised or a scab, and that I already know a disc injury is involved, okay? And it's more common than you think. I remember reading research, 95% of people will experience low back pain at any point in their lives. Now, I'm not saying all low back pain is disc injury. That's false, but you know, it's very common. Okay. Deep breath in. Okay, one more. Now we're gonna stretch. Breathe in. I know, and I'm gonna go nice and slow. Breathe, 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 breathe. Now I do have the heel decompression table, which can be better for larger disc injuries, but the fact that she is presenting with an antalgic lean, that tilt that she did, that's actually a contraindication for that table. Hence why I just don't have those tables lying around. This Cox technique can do a little more that the heel can't, at least for certain presenting patients. Okay. Good. Yep. One more out, and I'm gonna hold it. 5, 4, 3, 2, 1. Good. I'm gonna slowly bring it up. You wanna be careful bringing it up too fast, or chiros out there. You let go of this while you're pumping. It's kind of like a rebound test. That disc will just balloon up, causing excruciating pain. Okay. All right. You're good, you're good. Good. All right. Just gonna reassess. It's not too bad. Go ahead and use drops, okay? Just like every good chef tastes their creation after every added ingredient, as a chiropractor, you want to reassess the segments you just adjusted. Make sure you got it. Now I'm actually doing all 5 levels of the sacrum. Sacrum does have joints on every side, but they're not mobile, okay? But they're still joints, and they can be misaligned. Okay, breathe in. Just increase. One more. Out. Good. And then we're gonna do 1. Out, out, out. Good. All right. Let's have you turn face up. Yeah, take your time. I'm here to help you. What do you need?
Better if I get up and
However you want, Sushan. Okay. Okay, از چه بود زین آگری؟ Yeah, okay, thank you. Okay.
That's that.
Yep. And you kind of learn this as you go, right? Okay. There's no pain shooting.
Throw this here. No.
Okay. See how you bent? You're not bending anymore like this, right?
No.
Start getting used to it, okay?
Yeah.
You need it higher or it's good?
No. It's
Okay. Let's have you lay down and I'm gonna get my face up. Yeah. You could sit and then you could hold on to me if you need to.
I got it.
Okay. Yeah. Sometimes you wanna just let them do their thing. Lifting them too fast could screw it up. But yeah. Okay. I am actually going to bring this up like this, which opens up the low back just a little more, okay? If it's an inflection, you're flexing like this. So how did I treat her? I pumped her, so I flexed her, which causes these things to open up. Same concept here. She is flexing, opening these up. Could give her some minimal comfort while I'm treating right now. You ready? All right. We're gonna start with your hands. I'm actually gonna do ankles today.
All right.
Try to target the hips, get everything kind of moving, okay? I'm sure sleeping isn't fun. I instruct my patients, first thing I ask is, have you recently purchased or is your bed Tempur-Pedic or extremely soft? That is, you might think that's the best, but that's very, very bad for your low back. You actually sink in. Every time you want to turn or move, you're like in quicksand. So that has no support for the low back. So when patients are experiencing this type of pain, firm surfaces, hopefully they have a sleep number. If not, firm couch or the floor is going to be your only option, okay? So I'm just going to slowly bring it to your side. You okay? You're not going to fall. Is that what you're scared of? Do not tighten up. I need you relaxed here. Breathe in, out. Okay, that went very nicely. So I am gonna try to see if I could get a thoracolumbar. And breathe in, out. Good. Good. Okay. That's gonna help with the breathing. T4 helps with the heart. Okay. You okay? It's comfortable, like a little high up, right? Okay. Okay. Good. Was that too painful? This is not like necessary.
It's fine.
Okay. Just let it go though. Good. Okay. Let me get the hands and then we're gonna get. Yeah, but you need it. She knows what's coming. Okay. Good. Good. I usually don't do this with a flared up disc, but before she came here, she was bedridden for 3 weeks. Do you mind if I tell them the story? You're okay with that? Called the chiropractor to come to the house. He actually tried to adjust side posture, whatnot, and distracted the neck, which she told me she didn't experience crazy increased pain. So with that said, we discussed it. She gave consent knowing it might make it worse. We did distract, do the Y strap, which wasn't the most comfortable, but it did help her symptoms. So we're gonna continue it. If it's improving, we're gonna keep the same treatment, okay? But usually I do not. And if that doctor didn't go to her house for those 3 weeks, I still probably wouldn't have done it until a specific level of progression was experienced, okay? Or relief. You good? Good. Okay. Breathe in and out. Out. Good. Is it good? You're not choking? Okay. Try not to move your neck, okay? Make it a little more comfortable for her. Okay. So if I target uppers, it's gonna help relax her, get a better night's sleep possibly. But if I could angle it just right and time it, we're gonna go all the way down to the low back, and any inferior to superior mobilization will benefit her in the long run. Keep breathing. Out. You okay? Is that better? Okay. Deep breath in. Out. Good. Breathe in. Out. Good. Just don't guard. Good. Out. Out, out, out. Good. Deep breath in. All the way out. Good. It's okay to scream. Not as bad. No. It still hit the low back. Yeah, but you gotta understand. For 3 weeks, you were unable to get out of bed. So that first one was like,
Yeah.
right? Okay. So again, we don't know what to expect, but I know it wasn't gonna be as bad as the first one. I know you're plus you were guarded because you just were scared. So I'm not about to just thrust as strong or fast as I can. Okay, but we got what we needed. The last 2 segments, I mean, you felt it in the bottom by your tailbone. So that's exactly, we don't need the whole big, wow, this, that, but we got what we wanted, okay? I am gonna let her rest like this for a few minutes, okay? I would bend your knees, okay? This allows more flexion of the low back. I'm gonna dim the lights, okay? I'm actually gonna call one of the CAs. They're gonna put a nerve block with ice, but we could do it either seated or we could do it face down. Actually, let me get her neck and then we can do it. What position?
Laying down.
Okay. Or you could sit like this. We could. Okay. Okay. ¿Aquí estás? All right. Again, yeah, that's fine. You're fine. You can already. I just did that for your low back, okay? This is another patient that instead of having her come sit down due to the pain, we just do supine. Right there. Just drop. Good. One more. Okay. Someone was asking that C4 right there. Drop, drop, drop. Okay. And let's check for uppers. You all right? Mm-hmm. Got one more. Starting to sweat. It's actually a good thing. All right, and this is C2. Whoever's counting, drop. Drop, drop. Guess not. Okay. Good. Nerve block with ice. 10 minutes. Yeah. You're thinking about, if you don't put your patient as the primary focus of whatever scenario, you're going to hurt them. So same thing when she was face up. Now that she's face down, I'm actually going to push this down a little bit. This will give her more relief. Did that feel better? Yeah. Okay, good. So any small little change or personalization to the patient could be very important to the entire experience, okay? So now Demi here is gonna do a nerve block setting, okay? Ours are electric muscle stimulation, not a TENS. These go up to 4,000 hertz. So what we're gonna do is we're gonna shock it with 4,000 hertz, and it's gonna desensitize the nerve, which is what's causing most of her pain and her to walk like this. And like I said in the beginning, we're gonna finish off with ice, and then we're gonna advise her to wear the support, follow in-home restrictions, and we're gonna see her tomorrow. We're doing 3 days this week. Yep. All right. I told her I'll do my best to get her back to work on Monday, so we got 6 days left. All right. Stay tuned, stay adjusted, and unleash the cracking.